Namaskar viewers. In the health question series, once again a cardiology related discussion. And last week we saw the exercise related concerns and shocks that we have heard through various sources. To know what exactly it means and how it is not the only exercise, but there are many other parameters around it which causes such kind of shock to a person. So today, what is cardiology actually? What is heart-related concern or precautions person should take? And also the terminologies that we hear once in a while, what do they mean? So all this is a wisdom in a way. So for that, I have invited a wonderful friend of mine and a senior cardiologist, Dr. Deepak Krishnamurthy, once again from Bangalore. So Suswagatam.
Thank you. Thank you so much.
As I said in the opening remark, Doctor, when we get the sudden shock and we hear the ambulance sound, that's when we approach the hospital. And then we are in a complete panicky mode and we don't know what it is. So, first and foremost, I want to understand is what is the difference between heart attack and cardiac arrest?
Okay. That is one of the very important questions which is asked now and again by people, by patients, as to what is a heart attack, what is a cardiac arrest. In simple terminology, a heart attack is when there is a sudden stoppage of blood flow to a particular portion of the heart, when one of the coronary arteries supplying the heart muscle develops a blood clot and stops supplying blood. So that area of the heart muscle starts to get damaged, and if not intervened in time, if the blockage is not relieved in time, that area of the heart muscle can completely get damaged and die,
I see.
forming a scar. This is a heart attack, which is basically a medical emergency. A cardiac arrest, on the other hand, is where there is complete stopping of the cardiac activity. The heart stops beating because of an electrical abnormality,
I see.
where there may be a very rapid heart rate or the heart rate may stop completely, resulting in complete stopping of the heartbeat. A heart attack can lead to cardiac arrest, but not all cardiac arrests are due to heart attack.
I see. Okay.
In both, there are chances of recovery, but these are two different phenomena. In simple
Layman term.
comparison, heart attack is like a plumbing emergency where the blood supply has stopped. And if you relieve that blockage, the person will be fine. Whereas in a cardiac arrest, the heart has stopped beating. It has stopped pumping blood to the whole body. And there is no pulse, no BP at that time. So immediate CPR has to be performed. A shock has to be delivered to the heart to bring it back to normal beating. And then underlying cause has to be addressed. So cardiac arrest is far more dangerous
Dangerous, yes.
because if you don't intervene in the first few minutes doing CPR, giving a shock and bringing the pulse back, the person will not survive at all. Whereas heart attack is also a medical emergency, but the heart is still beating. The person is awake. The person has a pulse. The person has a blood pressure. And all the person needs to do is he or she has to be taken to the hospital, and immediate angiogram and angioplasty has to be performed to relieve the blockage.
Yes.
But if cardiac arrest person is not taken care of in the first 8 to 10 minutes itself, the person will not survive. So cardiac arrest is a far more dangerous and more immediate threat to life, whereas heart attack is also a threat to life, but the person is still talking, the person is still conscious, the person still has a BP and pulse.
Got it. Thank you. So now that it is so dangerous, what causes cardiac arrest?
So cardiac arrest may be due to one of the most common causes is a heart attack. If there is a blockage to a very major artery in the heart, it may immediately lead to cardiac arrest. The other reasons are the person may have some electrical abnormality in the heart, what we call as channelopathies. There may be some cardiomyopathy where the heart muscle itself is weak or enlarged, or the heart muscle is very much thickened. There are different types of genetic cardiomyopathy. So that may lead to a cardiac arrest. A sudden injury to the chest can cause a cardiac arrest sometimes. An electrical shock due to touching a live wire or electrical connection may lead to a cardiac arrest. Various other toxins and drugs can lead to cardiac arrest. So cardiac arrest
Emotional
has many
shocks also.
causes. Hmm?
Some sudden emotional shocks also can cause
Rarely emotional shocks can also lead to cardiac arrest, but not very common.
not very common. Yeah, go ahead.
So you might have heard of players playing football suddenly collapsing on
Yes,
field.
yes.
That is one example of a cardiac arrest. Most often that is due to a cardiomyopathy which the athlete may not have been diagnosed in the past.
Okay.
And this leads to a sudden cardiac arrest because it causes a rhythm disturbance in the heart where the heart goes very erratic and fast. There is no pulse and BP and the person collapses.
Mhm.
So these are all the various causes of cardiac arrest. The most common cause of cardiac arrest, which we come back to the first question, is a heart attack. So if a heart attack is very massive, can also lead to a cardiac arrest. But other structural abnormalities of the heart, cardiomyopathies, channelopathies, drugs and toxins, sometimes electrolyte disturbances like very low potassium level, very high potassium level, an electrical current injury, lightning, for example, if somebody hit by lightning, they may suffer a cardiac arrest. There are numerous causes of cardiac arrest. Of course, in any terminal patient who is dying due to any other disease, which may be a terminal cancer, terminal lung disease, very severe infections. Also, at the end, there is a cardiac arrest. That is more like a terminal event. That is not a sudden event because that is expected. But cardiac arrest can have various causes like this.
Okay, now that you just mentioned that it's a blockage. So blockage is nothing but a congestion of calcium.
Yeah.
Right?
Basically,
Deposition of calcium.
blockages were what talk about the heart. We talk about coronary arteries.
Right.
Coronary arteries are these blood vessels which supply blood to the heart muscle itself.
Yes.
Heart is a pump. It is made up of muscle.
Mm.
It has to pump right when the time we are in the mother's womb
Always.
till
Yes.
the day we are alive.
Yes.
It has to keep pumping.
Yes.
To pump blood, the heart muscle itself needs nourishment. It needs oxygen supply, which
Yes.
happens through the coronary arteries. If there is a blockage in the coronary artery, that can lead to this decrease in the blood supply to the heart, sudden stoppage of blood supply to the heart, resulting in chest pain, resulting in angina, resulting in heart attack. These blockages are nothing but cholesterol deposits on the inside. The blood vessel is like a tube. On the inside, there is a smooth layer called endothelium, in which cholesterol deposition starts to happen. With time, this cholesterol becomes harder. There is calcium deposition also. There is fibrosis also, and further calcium deposition and cholesterol deposition keeps happening, and the artery becomes narrow over time. This
Ah.
causes chest pain or angina.
Ah.
But when it happens suddenly, due to this deposition is called plaque.
Mm.
This plaque, when it ruptures suddenly, it can
Mhm.
cause a blood clot over that region,
Okay.
completely blocking the blood flow. That is a heart attack. So basically, blockages are cholesterol deposits with some calcium component also. And there are two types of progression of plaque we talk about. It can slowly progress over many months and years, leading to chest discomfort, angina, where a person walks, he gets chest pain, he sits down, he becomes okay. That is
Palpitation.
called
Yes.
stable angina. Whereas when there is a sudden stoppage of blood supply to the heart, it causes a heart attack. These are the two types of blockages. But basic mechanism is same. There is a slow buildup of cholesterol with calcium inside the blood vessels, which may suddenly block sometimes with a blood clot. When the blood clot is there, it is a heart attack. In stable heart disease, like somebody having years of angina or chest pain due to heart problems, there is no blood clot.
Mm.
Whereas a blood clot forms acutely. And whenever a blood clot forms inside the coronary arteries, there is a heart attack, either a minor or a major heart attack.
Invariably, all the human being will have this calcium deposition or cholesterol for that matter.
Uh, See, everybody will not have a significant amount of cholesterol buildup,
Yes.
but beyond a certain age, say
Mm.
above the age of 60, above the age of 65, invariably some amount of cholesterol deposits will be there.
Mm.
But these are not narrowing the arteries,
Okay.
these are not producing any
Okay.
disturbance to the blood flow.
Okay.
But in people who have more deposition of cholesterol, there is significant blockage of blood supply leading to symptoms. But in people who develop plaques,
Mm.
it has been seen in autopsy studies that it can happen as early as the second decade of life, meaning in your 20s and 30s,
That is,
there can be plaque formation. It is not that a 20 or 30-year-old is completely normal in terms of coronary arteries.
Correct.
Some of them may have plaque formation at that age itself.
Yes.
That is why when people smoke,
Yes.
people get into wrong lifestyles and
Lifestyle.
wrong diet and sedentary lifestyle. They
Yes.
can develop a heart attack as young as 20 and 30 also, because plaque formation happens much more rapidly in them and leads to heart attacks at younger age.
What is okay? I don't want you to explain what it is, but what are the causes of congenital heart diseases like pole and etc.
Congenital heart disease is a completely developmental malformation. When the fetus is developing inside the mother's womb, various organs are forming,
Correct.
and the heart, the kidneys, the excretory system, the intestines, the stomach, the brain, the spine and spinal cord, musculoskeletal system. Any of these systems can have uh, abnormalities during development. Sometimes
Disorder.
these are related to viral infections in the mother. Sometimes it is related to certain medications taken by the mother without knowledge. Sometimes it may be due to nutritional deficiencies in the mother. There are various reasons. There is no one particular reason. These are consumption of alcohol during pregnancy.
Yes.
It is one of the important causes for congenital malformations in the children. Smoking during pregnancy, consumption of other recreational drugs during pregnancy. These can also lead to congenital malformations of the heart and other organs. So one of the portion of the heart doesn't develop properly, leading to a hole between one of the chambers, an abnormal connection between one or two blood vessels, complete disorientation of the heart formation, leading to complex congenital anomalies. So from a simplest small hole in the heart, which may close by itself over time, it may also lead to complex congenital anomalies requiring multiple surgeries after the child is born. So there are various reasons, no one particular reason for congenital heart disease.
There are two terms which I have come across, systolic heart failure and diastolic heart failure. It has something to do with male-female ratio or something else?
Not really. Earlier, we used to use this term called systolic failure and diastolic failure. Systole is basically the pumping phase of the heart, when the heart pumps blood out of its chambers. Diastole is when the heart is relaxing, the ventricles are relaxing and filling with blood from the atria. Atria are the upper chambers, ventricles are the lower chambers. Diastole is the relaxing phase of the heart where the heart receives blood. Systole is the pumping stage of the heart, phase of the heart where it is pumping blood. So, systolic heart failure means the pumping capacity of the heart is reduced. Diastolic failure means the relaxation capability of the heart is impaired because the heart is stiff, either due to very high blood pressure, age-related factors, some infiltrative cardiomyopathies, and other reasons. So these were the earlier terminology used. Normal pumping of capacity of the heart, what we call as ejection fraction, is around 60 to 65%. Okay. Some people ask, why is it not 100%? The ventricle never becomes empty. When it pumps around 65% of the blood that it contains. 25 to 30% remains in the heart. It further fills and then again pumps. So it never completely empties out. That is why it is 65% normally. But in systolic failure, or where there is impairment of the pumping capacity of the heart, this reduces to below 60%, below 50%, below 40%, below 30%, which we categorize as mild, moderate, severe LV systolic dysfunction. The new terminology is slightly different. It says heart failure with reduced ejection fraction and heart failure with preserved ejection fraction. More or less same as systolic and diastolic failure, but these are the new terminology. Is it something that women have more of a systolic and men have more of a other one? No. Because heart attacks are more common among men. Men, yes. Systolic failure is more common among males. Male. Because heart attack is one of the main reasons why the heart muscle gets damaged and the systolic function comes down. So naturally, systolic heart failure is more among males. Whereas among women, heart attack below the age of menopause is slightly less common.
Ah,
So
yes,
systolic heart failure is also less common among women.
women.
But if they suffer a heart attack, they also tend to develop the same
Yes, yes.
systolic heart failure as men. But if you take the overall numbers,
Hmm.
you will find that diastolic heart failure or heart failure with preserved ejection fraction is slightly more among women,
Ah,
and systolic heart failure or heart failure with
more among men.
reduced ejection fraction is more common among men, mainly because of the difference in the incidence of heart attacks.
Got it. Um, you have been educating and spreading the awareness about smoking all through. How does the smoking damages, and is it something so bad that it will, there are no hopes of recovery, or it will delay the process of recovery also? Because there are people who promote or who, argue that I have been smoking all through my life and I'm perfectly all right because I do cycling, I do gymming, everything is fine. So how should and why should I stop?
So, smoking, when it comes to heart attacks, is a definite risk factor. It has been proven beyond doubt that when you compare smokers versus non smokers, the incidence of heart attacks and heart disease and heart failure are definitely higher among smokers than non smokers. When
What
it comes
happens?
to when it comes to lung disease or cancer,
Mm,
there is a certain number of smoking years,
mm,
what we say.
mm,
If somebody smokes one pack per day for 10 years, they will develop lung disease.
mm.
Or somebody smokes one pack for so many years, develops cancer. Those numbers are relevant to lung disease and cancer. But when it comes to heart attacks, even somebody smoking one or two cigarettes per day or two, three cigarettes per day is also at risk of developing a heart attack as much as somebody who's smoking heavily. There is no safe limit or number correlation when it comes to
Okay.
smoking
Mm,
because smoking contains certain chemicals, nicotine, and other harmful factors which directly damage the endothelial lining of the blood vessel, which I was talking about earlier.
yes.
The inner lining of the blood vessels or the endothelium. When somebody takes a single cigarette, immediately in half an hour, one can experimentally demonstrate endothelial dysfunction.
Mm,
So it is that acute. And during that phase of endothelial dysfunction, clots can form immediately, especially in the heart, in other blood vessels. Clots can form immediately, even in somebody not having a blockage per se. Somebody may have a normal coronary artery. Even in that person, a clot can form within the coronary artery and lead to a heart attack. So, this acute endothelial dysfunction or endothelial damage, which happens with smoking, is the reason for the heart attacks. If somebody says, I've been smoking for so many years, we can only tell them that you have been lucky.
mm,
And it is not a 100% thing.
true.
100%, 100 people smoking, 100 people will not develop a heart attack.
Mm,
But a majority of them will. For example, one may close their eyes and cross the road. If they
mm,
are lucky, they may survive.
mm,
But if they're not lucky, they will get hit by a vehicle. Because somebody survived doesn't mean that, okay, that
yes.
fellow survived, so I will also survive.
Mm.
It's common sense. But smoking is one addiction. I may,
One more addition here. Even the
yeah,
tobacco is equally dangerous.
absolutely. Smoking, of course, is the most dangerous form. But chewing tobacco, even the jarda and other
Yes.
tobacco, flavored tobacco, whatever they call it, all of these are equally bad
Mm,
and they can lead to heart attacks and heart disease. People say that chewing tobacco is not as dangerous,
mm,
smokeless tobacco is not dangerous,
mm.
but it is not true. There are studies available, Indian studies which have been conducted and shown that there is a definite correlation with use of any form of tobacco and heart attacks. So it is not safe. Of course, the most dangerous one is smoking, but the other tobaccos are also equally harmful. So if somebody says, I will switch from smoking to chewable tobacco, it is wrong.
But then that causes other complications like mouth cancer and other things.
See, that is what I tell many of my patients who smoke
Mm,
that you may survive a heart attack or you
yes.
may not get
Mm,
heart disease,
mm.
but you will definitely get lung disease.
Something,
You
yes.
will definitely get cancer. You will definitely get some other disease because
Mm,
smoking is not just associated with one problem. And
yes.
I tell them that the only party who is getting any benefit in
Mm.
the smoking is the people who sell the
Really, yes.
cigarettes.
Absolutely.
The patient has nothing to gain except for those few seconds or minutes of pleasure or whatever they get the kick out of the smoking, they do not really get saved in any which way. It is dangerous, it has to be stopped. But as I told, it is one of the most difficult forms of addiction to stop. Just me telling somebody stop smoking is not effective. They have to make up their mind. They have to set a date to quit, try hard, reduce slowly, quit on a day, and it takes on an average 2 to 3 attempts to
Yes.
stop smoking completely. They have to try. If they fail once, it is okay. They have to try again. On an average, it takes 2 to 3 attempts to quit smoking. But surprisingly, when people develop a heart attack
Mm.
and I tell them to stop smoking,
Mm.
90% of them stop smoking because the fear of life is something beyond
Unfortunately.
any telling or counseling or anything. Once they get that scare, they definitely stop smoking 90% of the time.
And somewhere I think there should be some stringent policies also on the sale of this, maybe heavy taxation or something. Uh,
That is unfortunately a very controversial topic
mm.
because there is a huge revenue for the cigarette companies, for the government collecting taxes and various parties involved.
Yes.
And it is something which has to happen over years. It takes a lot of social, economic, and other measures to bring in that formulation. Already, cigarettes are taxed quite
Yes.
heavily.
Yes.
But despite that, the addiction is such that people may uh, forego eating food, but
Yes.
they'll not quit their cigarette.
Yes. Yes. True. It's a status symbol, fashion, whatever you call it, but it is there.
Peer pressure.
Yes.
Usually, smoking starts somewhere during college days.
Mm.
You will not be considered cool. You cannot be part of certain groups if you don't smoke.
Yes.
So that thing gets in somewhere, and then it becomes a
Addiction.
stress buster.
Mm.
Then it becomes an addiction to the point that people cannot start their day without a smoke.
Mm.
And it comes to a point where they have to think about it and
True.
quit at some point. But unfortunately, before that, most of the damage is done.
And absolutely, it's too late by the time they realize it. Just now, when you in the beginning, you said that there is something called a gradual deposition. So, such potential heart patients, will call them. Can they live up to 70% blockage scenario with the asymptomatic conditions?
Yes. When the deposition happens very gradually, I'm not talking about a heart attack,
No, no.
very slowly over
Again.
months and years,
Mm.
until the blockage becomes more than 70% narrowing of the diameter of the artery, usually does not produce symptoms. And even after it exceeds 70%,
Mm.
symptoms may be present only during physical exertion, like
Okay.
walking uphill,
Oh.
climbing stairs,
Other
running,
activities
doing
are.
something strenuous, walking after a meal, what we call as angina,
Yes.
which is brought about by physical activity. At rest, generally they are okay. When the blockage crosses 90% is when people may start getting symptoms even at minimal activity, like making a bed,
Huh.
getting out of bed, brushing,
Huh.
passing stools,
Mm.
just walking in and around the house, they may start getting some symptoms. And above 90 or 95%, they may also start getting episodes of pain at rest
Yes.
or during emotional stress,
Yes.
during very minimal exertion, which they may not even notice. It starts producing more and more symptoms.
Some people, we have heard that, like somebody was watching a match and he or she was very emotionally attached to that event, and
Mm.
sudden shock and it's a heart failure.
Yeah.
Somebody went through some really unfortunate episode of life and could not take it and heart attack. What happens? Is it completely a stopping of blood circulation or something more to it?
So during acutely stressful situations, I mean mentally stressful situations, two, 3 things can happen. One is, of course, a heart attack. They may have some blockages in the heart, which are not really more than 70%, maybe 50, 60% kind of blockages. But when there is a sudden stress, the blood pressure shoots up, the heart rate shoots up. This causes a stress on the already existing 50, 60% blockages. They rupture, leading to a clot formation and a heart attack. That is one thing. Second is what we call as stress related cardiomyopathy or stress induced cardiomyopathy, where acute stress in the form of somebody's death in the near family, or some very stressful situation, they may develop what we call as stress-induced cardiomyopathy, where there is no blockage, but because of the acute surge in the sympathetic hormones, adrenaline, and other hormones in the body, the heart pumping can suddenly reduce. The heart can actually get enlarged. What is in common language known as broken heart syndrome.
Yes, yes,
People can present with a picture very similar to heart failure and heart attack,
yes.
but when we do their angiogram, they don't have any blockage. And when we go back to the history, we find that there was a very stressful situation leading to stress induced cardiomyopathy or broken heart syndrome. The other is, of course, heart attack. Sometimes very stressful situations can trigger a cardiac rhythm disturbance, leading to a cardiac arrest, which is not very common but can happen. The other
Not
important thing about sports,
जी,
among sports fans, especially
yes,
football
yes,
fans and the others,
yes,
during this football season, people drink a lot.
yes.
Every
अच्छा,
football match, people sit with beer and
yes,
other liquor, and they keep drinking through the match, keep eating through the match. They
yes.
don't realize how much they've had. And
Mm-hmm.
sometimes such alcoholic binge can itself trigger a cardiac rhythm disturbance, leading to cardiac arrest. Such an alcoholic binge can lead to a heart attack. It can lead to sudden cardiac arrest. Alcoholic binge is a strict no-no. If you drink moderately, say 2 or 3 times a week, and stay in limits, generally it doesn't cause too much of cardiac issues. But if somebody suddenly drinks a large amount of alcohol, it can lead to such uh, complications.
Complications. Yes.
So this commonly happens during football season and other
Yes,
sporting
yes,
events, where
yes.
people are at home with friends or in sports bars drinking and watching TV and suddenly go into cardiac arrest.
Hmm. Mm, generally, the mindset is I avoid going to cardiologist. I avoid doing test. I don't want to undergo the ECG and other primary test. Mm, I think that I'm all right. I'm all right because there is no symptom. Uh, to such society section, what would be your advice?
See, this is a very common human attitude, not something uh, abnormal. That people, when they do not have much symptoms, or even if they have some symptoms, people are generally in denial. They
Mm.
don't want to accept the fact that there could be something wrong with them, especially with the heart or something major. And they try to postpone, thinking that it will go away, it is something minor, it is just gas, it is
Yes, yes.
just some stress and strain.
So they
Because
go to the extent
what
saying that I will have home remedy and it will reduce.
Yeah. So basically, that denial is one of the major risk factors, I would say, apart from smoking, diabetes, blood pressure, cholesterol. Denial is a very huge risk factor because nobody wants to accept. Because once you accept that you might have a problem, then you have to go to the doctor, undergo tests.
Yes.
Then, if something comes out in the test, then you have to do some changes in your lifestyle. Maybe you'll have to undergo some procedure or surgery. So, that whole thing scares people a lot, that everything is going to change. People will look at me as a heart patient. I will no longer be considered healthy
Normal,
and
huh?
normal.
Mm.
So, this thing of uh, normal, people think that they should have no problems at all and only then it is normal. Normal can be with some disease also. Somebody may have a heart disease, but they may undergo proper treatment and surgery or angioplasty, and they may live a normal life. That is not abnormal. Abnormal is denying everything, having some problems but not addressing it, and still trying to live and say I'm considering myself like one hero. I don't want to that image to be spoiled. That is abnormal actually. But people have to come out of that denial. Sometimes, unfortunately, it takes a heart attack for them to come out of that denial. They
True.
keep denying all the risk factors. They keep denying all the symptoms,
Yes.
and they'll end up in a major issue. And then, when you ask them, they'll say that yes, I had this problem. When you go back into the reports, you'll see that their cholesterol was always high, blood pressure was always high. They never took treatment. Sugar was there, but not under control. But people will tell everybody else that I was fine and then suddenly I had a heart attack. They were not fine. They were in denial. That's all.
Mm. Okay, next, doctor, after certain age, 40 plus, on an average, what kind of test would you prescribe to somebody as a cardiologist? whether they are smoker or no, whether they are having a high intake of alcohol or no, whether they do not have any symptom or no. This is primary just to be on safer side.
See, first of all, I would like to say that above 40 is not the age to get your health check done.
Hmm.
Now that we see more and more people with younger age groups having heart attacks, people in 25, 28, 30 getting heart attacks,
Yes.
age is not really the criteria. So, anybody above the age of 20
Oh,
should have basic tests.
sure.
It may not be the everything like a treadmill test, echo, angiogram, everything. But above the age of 20, at least once in 2 years, people should get their sugars, blood pressures, cholesterol checked. They should check their weight. They should check their waist circumference. They should check these basic parameters to see if they have any kind of risk. Because when I keep discussing with my pediatric colleagues, they tell me how much common childhood obesity is.
Yes.
Teenagers weigh more than what we weighed as adults at the age of 30. Teenage obesity is common, childhood obesity is common. So by the time they are in their 20s, many of them are already pre diabetic,
Yes.
many of them already have borderline blood pressure, many of them have borderline cholesterol. So anybody above the age of 20 should have some basic tests, and anybody having a strong family history of heart disease should have earlier tests because they tend to develop heart attacks early. And apart from these basic tests, what I mentioned, which is basically height, weight, waist circumference, cholesterol, sugar, uh, and blood pressure, after the age of 30, one should have regular ECG, echo, treadmill test to see if everything is okay. See, if somebody exercises regularly, does a decent amount of physical activity, it is easy to notice symptoms. They may get some chest pain, they may get some discomfort. But if somebody is completely sedentary, most of the time on the chair or couch or bed, even if they have blockage, they may not notice it
Realize it.
because
Yes.
they are not even doing that basic amount of physical activity.
Okay.
So symptoms become a very difficult thing to assess in such people. So unless they do some treadmill test where we put them on a treadmill, make them exercise, see how their effort tolerance is, if they're really normal. So we have to tailor according to each individual's family history, body weight, and other factors. And these tests basically are not done to detect blockages. There are two different things which I've tweeted some time ago.
Yes, yes.
One is a health checkup. A health checkup is basically to assess the risk level. By checking all these parameters, you get a fair idea about what kind of risk we are looking at.
Correct.
And after that, the person has to address those risks by changes in diet, stopping to smoke, doing regular exercise, trying to bring these factors, be it blood pressure, sugar, cholesterol, down, getting their weight back to normal. This can, in the long term, reduce heart attacks and improve their overall survival. Whereas when somebody comes with symptoms, some chest discomfort, breathlessness, chest pain, there what tests we conduct, ECG, echo, treadmill test, maybe a CT angiogram or an angiogram, that is basically to search for what reason this person is getting chest pain, what kind of blockages this person might already have, and to address those in order to improve the quality of life, to address those blockages, that is treatment. So there are two things. A checkup can be due to risk assessment, or it can be due for detecting these problems. So people should not get confused between the two. Somebody will come for a health checkup and say, "Do I have blockages?" I say, "I don't know. You might, but these are the risk factors you have, which you need to address. If you address, the chances that you might land up with a heart attack will become less." This is about probability. One may have a very high probability of a heart attack. Somebody may have a low probability of a heart attack. It is never zero. The probability of heart attack is never zero for any human being. Some probability is always there, but you have to keep that probability low by reducing the risk factors. So getting confused between risk assessment and detection of blockages are two different things. So people should understand the purpose of the checkup. If they've come with symptoms, I'm going to look for blockages. I'm going to treat those blockages, trying to give them relief. If they come with viewpoint of getting their risk assessed, I do a different set of tests to assess their risk.
Thank you. That's a very important piece of information. You mentioned two things just now, and then that gives rise to two questions. One is it genetic and why?
So, heart disease, which we talked basically about heart attack, has a genetic predisposition. If you have one or more immediate family members, that is first degree relatives like parents, brothers, sisters,
Yes, yes.
having had heart attacks in the family, especially below the age of 60,
Mm,
which we call as premature coronary artery disease, then your risk of developing heart disease becomes 2 to 3 fold higher
I see.
compared to somebody who doesn't have a family history. There is no one gene, there are multiple genes which predispose you to heart problems. So, if you have a family history, you will be at a slightly higher risk. More the number of people in the family who have had heart attacks, angioplasties, bypass surgeries, especially at younger ages, your heart disease risk becomes that much higher. So, conventional risk stratification or conventional evaluation in such patients may not yield much results. We have to be a little more aggressive in such patients, maybe do CT angiogram more regularly in such patients to detect blockages because these cannot be conventionally handled because they have a genetic predisposition. If you do not have a genetic predisposition, we have to look at other risk factors and more conventional risk assessment can be done.
Yeah.
But in somebody having strong family history, it is a definite high risk factors.
Yes,
So they have to be addressed more aggressively to prevent complications and to prevent death.
and they should be more careful and precautionary about their
Yes.
other.
Yes. So I tell my patients that you cannot change your genes. As on today, there is no therapy to change your complete genes to make it all good. So the thing you can do is at least prevent other problems. Don't smoke.
Yes.
Don't get obese. Be more physically active.
Absolutely.
If you have diabetes and blood pressure, keep it under control
Yes.
so that additional risk factors don't add up and cause more problems because you already have a family history.
Got it. And I think it is by and large applicable to everyone.
As Indians, we are at a higher risk of developing heart attacks compared to other races and other ethnicities. So that itself is a major risk factor.
Absolutely. Okay. Though we say we shouldn't be gender biased, but heart attack is gender biased. And why do they not advise treadmill tests for women? Is it not very effective?
The thing is, among women below the age of menopause, the risk of getting heart attacks is low because the estrogens offer protection against blockages and heart attacks. Vascular health is maintained. But if somebody is smoking, because women also smoke and it is quite common nowadays, if they have diabetes, if they have blood pressure, if they have high cholesterol levels, or if they have a strong family history, being a woman may not be really be protective. Even women can be at equally high risk as men if you have these risk factors. And above the age of menopause, the risk becomes equal.
Yes.
Treadmill test as a routine is not recommended even for men. As I told you, treadmill test is basically to assess effort tolerance, to look for indirect evidence of blockages. So routinely it is not recommended for everybody. As part of health checkups it is done, but the idea there is to more look at effort tolerance, how much of exercise can be advised, and what modifications can be done. But women should also undergo health checkup to assess their risk of heart disease as much as men. And the other thing is, world over, it is noticed that when a woman comes to an emergency with heart related symptoms, a woman is less likely to be taken seriously in terms of heart attack. When a man walks in with chest pain, it is more or less certain that he has a heart attack. But when a woman walks in with chest pain, most of the time, even the doctors don't tend to think about heart attack. They tend to think about acidity, muscular pain, and other causes because this general bias is there that women don't get heart attacks. So that leads to delayed treatment, delayed diagnosis, and more complications. And women also tend to present with more atypical symptoms. Men tend to present typically with chest pain,
Mm,
burning sensation, sweating, and all these classic symptoms,
mm,
whereas women tend to present more with dizziness, nausea, vomiting,
mhm,
general uneasiness,
mm.
pain which is not very crushing and severe like in men. So the
I see.
presentation itself can be slightly
I
different
see.
also.
I see. I see.
So because of all these factors, women when they come with heart attack
Mm.
tend to get more complications because of delayed diagnosis and
Yes,
treatment.
correct. Got it. There is now just that you are talking about the various tests that somebody should take to identify whether he or she is a potential candidate. There is a test called coronary calcium test also, and
Yes.
which is without dye, if I understand it correctly.
Yes. Yes.
It's little costly compared to other tests.
Yes.
Um, which one is safe to undertake? Not safe as such, which is more appropriate or correct for you to get the right data.
So as I told you earlier, there is risk assessment
Uh,
and there is looking for uh,
the damage
problems
problem. Yeah.
which are causing symptoms.
Symptom. Yes.
So a CT calcium score is for risk assessment.
Okay.
When you do a CT calcium score,
Mm,
if the calcium score is low, that means indirectly that your plaque burden
mm.
in the coronary arteries is very less,
What's the range?
below 100.
I see.
So above 100 to 400 is moderate, above 400 is high.
Okay.
So if it is in the high range, that means that you are likely to have a lot of plaques in your coronary arteries. So your risk of developing a heart attack becomes higher. But that doesn't indicate blockage is there or not.
Mm,
It is only indicative of plaque burden.
mm,
Whereas a CT angiogram, when you do, where a dye is injected and CT is performed, you
mm,
look for blockages. You
mm,
will come to know what blockages are there, what percentage is there, what is the reason for chest pain.
mm.
So a CT angiogram is to look for blockages, whereas a CT calcium score is to assess the overall risk.
Risk factor.
So if
Got
somebody comes with chest pain,
it.
if I do a CT calcium score, it will only indirectly tell me that there may be something wrong, may not be something wrong, but it will not give me an exact idea about blockages. So if somebody comes with symptoms,
Mm,
it is going to be a CT angiogram if indicated.
mm.
If they come for risk assessment, CT calcium score is good enough.
Makes sense. The major impact on the society was a COVID, and that has led to a number of complications because the not the virus only was a dangerous thing, but other symptoms also, and even the vaccination for that matter is also a doubtful case. Um, was there due to infection, it was causing inflammation in the vessel and resulted into heart attack, or also addition to that, priorly people had a cholesterol composition and that added to the misery.
See, before even COVID happened, we used to have influenza
Yes,
seasons.
yes,
Whenever there is a flu season or influenza
yes,
season,
yes.
people tend to get more heart attacks,
Mm,
especially older people,
mm,
diabetics, people who have blood pressure, because any severe viral infection, viral respiratory infection in the body can put a burden on the cardiovascular system, can lead to heart attacks.
mm.
COVID is also a kind of I mean, it is a viral
Virus,
infection,
yes, yes, yes,
causes significant respiratory infection.
yes.
So by itself, it leads to an increase in risk of cardiac events. In addition to that, COVID has a specific propensity,
Mm,
especially in moderate to severe cases
mm.
who required hospitalization,
Yes,
to form blood clots within the blood vessels of the heart, blood
yes.
vessels of the brain, lungs,
Lungs, yes,
legs, everywhere.
yes.
Venous as well as arterial thrombosis is common in severe COVID cases because it causes endothelial damage. Similar to how we spoke about smoking causing endothelial damage, COVID also causes endothelial damage. It also activates the clotting system in the body, but this tends to happen in severe cases of COVID.
Mm,
In mild and moderate cases, generally these vascular events do not happen.
mm,
There is also some evidence that people who have had COVID in the long term
mm,
have some increased risk of developing cardiovascular issues, but the proof is not very strong. The evidence is not really that great,
mm.
but there is some suggestion in this regard. Coming to vaccination, it has been published across different journals and everywhere that the vaccines have a slightly increased risk of blood clotting,
Yes.
especially the Covishield vaccine causes a slightly high increased risk of blood clotting, but it is not a very huge number. If you consider in India,
No.
there have been nearly 200 crore doses administered,
Yes.
or more than that. That
Yes.
is double the population has already
Yes.
been administered. But if we see our practice, we
Yes.
do not see so many heart attacks and
Yes.
people
Yes.
coming with blood clots
Mm.
among vaccinated people. If it was so common,
Mm.
our emergencies and our ICUs
Yes.
and CCUs would have been flooded with heart attacks and
Mm.
strokes and pulmonary embolisms and everything. It is not happening.
Mm.
So whatever heart attacks and other cases are happening post COVID,
Mm.
these are usually the same patients who used to come earlier as well, in the sense,
Mm.
same profile of patients, similar age group of patients, similar risk factors.
Mm.
The only thing is, in the last 2 years or 2.5 years of COVID, people have been more indoors, have
Okay.
been more sedentary. They haven't been to their doctors. They haven't got their sugars and blood pressures checked. Even cardiac patients haven't come for follow up. So this itself leads to a much higher risk of developing heart attacks than compared to the vaccine or the virus itself. It is very, as I told earlier, denial among people is very common regarding heart disease. Now they have a reason
Mm.
to say COVID,
Yes.
but we were treating heart attacks even before COVID.
Yes.
Cardiac arrests were happening even before
Yes.
COVID,
Absolutely.
and the numbers really haven't increased that many fold to say that COVID has caused a huge surge in heart attacks or the vaccine has caused a huge problem in this regard.
Mm.
So I keep telling on even on Twitter and other people who ask me
Mm.
that we are seeing more or less same numbers as before. We are not seeing a dramatic increase
Drastic
in numbers
change.
at all.
Mm.
And the age group also, people talk like as if cardiac arrests are happening for the first time among young people.
Mm. Mm.
Young people have died in the past also. Young people have had heart attacks in the past also. Even 5 years ago, I have done angioplasties on people who are 28, 30.
Okay.
It is not only after COVID.
Mm.
So people have to understand that as a doctor, I have no reason to hide
Mm.
or say that no, COVID did nothing. I mean,
Mm.
if it does something, we will tell the patients that it is doing something. Be careful. Or if the vaccine is so bad, we would have come to
Yes.
know by now. It
Yes.
is not that. It is a
No. No.
misconception, unfortunately. There is a lot of fear mongering and social media.
Mm.
Now there is a CCTV everywhere. It captures somebody dying. That gets amplified in 10 different ways.
Yes.
And it creates such a scare in the mind that people start worrying unnecessarily about things which they needn't really worry about, and they stop thinking about things which they actually should be
Should
thinking
be
about,
worried.
like exercise and diet and
Mm.
regular medical follow-up, which is basically what they need to do. I would suggest that keep health as your priority. Uh, Unfortunately, for most of us, including doctors, number one is career, number
Yes.
two is family, number three is money, number four is house, number five is car, and health come somewhere sixth, seventh, or eighth down in the line, or not even come in the priority list at all, and
Mm.
only comes in the priority list when something happens. So, health should be a priority. So, people should dedicate some amount of time to themselves, have some work life balance, take at least 45 minutes to an hour every day to do some exercise, do some yoga, do some meditation, look at yourself, check your body weight, check your blood pressure. If you are diabetic and having other risk factors, keep them under control. See your doctor regularly. Read about your disease. Educate yourself about the disease. What better you can do. How you can improve your quality of life. How to prevent complications.
Yes.
There's no need to be paranoid,
Yeah.
but a certain amount of education,
Mm.
a certain amount of uh,
Awareness.
knowledge about your own problems and awareness
Mm.
goes a long way
Mm.
in keeping you healthy and out of hospitals and free from procedures and operations. Uh, Everybody should exercise regularly, keep their diet under control as much as possible, stop smoking, avoid excessive intake of alcohol, and be aware and be educated.
I think from my side, invest as good as in your health as you invest in other parameters. So that will definitely bring more happiness and more prosperity. Thank you very much, doctor, for your time, and that was really enriching. Thank you so much.
Thank
Namaste.
you.